share data with our sponsors, who are pharmaceutical companies or federally funded agencies, and our data are used, analyzed statistically in order to determine if a drug is working.
We share data with, certainly within our own group, but we also have collaborators all over the world. We have a fusion research device, and within that community we have other labs that have researchers come and do research at our site, and then they also do research remotely.
We share data with our sponsors, who are either pharmaceutical companies or federally funded agencies like the National Institute of Health or National Eye Institute. We either provide them with a text file and upload it to a secure web server, or we create a text file and copy it onto a CD, which is encrypted. So
the main way that people collaborate in terms of looking at our data is that they log into our servers, and they use a secure shell connection, SSH. And basically this is just you log in from a command line to get into our servers, and then you have access to all the data on our RAIDs, which are just big storage devices. And they have access to their accounts. We set up accounts for individual collaborators, and then they have the software tools they need to actually analyze it locally, or to actually download the data to their own servers and use their own tools.
Did you have a lot of problems setting up the user accounts?
The user accounts are not too bad a thing. We have central servers. People generally all need the same kinds of tools, so once we had a centralized server, it wasn't too bad to add more people. Security was our biggest concern, but firewalls are pretty easy these days, and so it's been pretty smooth. So sharing data with other people means that we have ideas coming in from other research groups. So for instance, one of our big collaborators is in Italy. They have a similar fusion research device. They come with their own ideas, and they actually will build a device to come back and attach to our machine and take data with that then we look at. But having those people and their ideas has really helped the group a lot. It also means more funding too, because we actually get money for other groups to come and put their experiments on ours. And if we couldn't share data, that would be very difficult for them, and a less rich environment for them. Our
data sharing primarily is with the sponsor, and as I said, to statistically analyze for a clinical trial. So our benefit is pharmaceutical drugs. The federally funded studies will provide more epidemiological information. Historically, our group developed the diabetic retinopathy scale. So as diabetic retinopathy, the disease progresses, how the eye is affected. So that was one big benefit, in addition to all the great pharmaceuticals that have been able to help people keep their vision.
The biggest benefit of sharing data is that people know what's new and works, and what's new and doesn't work. So we have a lot of collaborators within the fusion community, and we're all kind of working on the same problem. They all have different devices, but you learn how to do something at one site, and people know the usefulness of that at another site. The other big advantage is people are looking at our data, and they're getting their own ideas, and some of them will actually construct their own devices to bolt onto our experiment, and they will come and do that. But they wouldn't necessarily know what's appropriate for ours without seeing the data. And so having people be able to look and sort of be involved in our experiment has helped greatly to advance the progress of the experiment.
Collaborations are always good when you can not have to go back and reinvent the wheel every time, when you can also build off of other people's ideas. Our primary benefits of sharing data are that we work on developing a clinical drug. So if the data we generate are statistically analyzed and show a benefit to the patient, then the drug will go on the market. So we really, it's very rewarding to be able to see the work that we've done result in a drug that can preserve someone's vision.